Hey everybody, this is Kevin Bass from thedietwars.com. I'm a medical student and a PhD student, and I'm finishing up my PhD. I've done most of my medical training, half of my medical training. I'm about to finish my last half of medical training. And I'm going to talk to you guys today about why and how 95 to 98%, maybe even 99% of what you hear about from online health influencers is bullshit. It's bullshit, it's pseudoscience, it's misleading, it's gonna waste your money, or it's even gonna hurt you. 95, 98, 99%, the vast majority. And we're talking about the largest health influencers. All of the big famous names that are on Joe Rogan Experience, et cetera, the biggest leaders of the plant-based movement, the biggest leaders of the vegan health community, the biggest leaders of carnivore, the biggest leaders of keto, biggest leaders of everything. They're all full of shit. And they're all saying things that are wildly at odds with what science says. And it's almost a hard thing to believe. How is it that the industry, that the health industry, the online health industry is systematically bullshit? How is that possible? That's the topic for another podcast, like how it became this way. But for this podcast, I'm going to explain to you the fact that it is, and I'm going to explain to you how it is the case. Like, what makes it bullshit, right? All of these different segments of the online health influencer industry have in common with each other such that they are all bullshit. And then, of course, as I've said, in maybe the next podcast on this subject, or maybe in a month, I'll be talking about why this became the case. But and I've already talked about it in previous podcasts, but I'll have a whole podcast episode dedicated to it. But in this episode, I want to just talk about the fact that they are all bullshit. They're all bullshit. Okay, enough of that. So here, now, I'm going to explain. All right. Basically, it all relies on over-extrapolation from weak data to sensational, overhyped, and sometimes claims that do not convey the proper risks that are involved with the intervention that's being promoted. So it's either dramatically overhyped or undue caution, which is almost the same thing as dramatically overhyped. The benefits to harms ratio is drastically overstated on the basis of weak data that cannot support the strengths of the claims being made. And that is the overwhelming quantity of such claims in the prominent and most popular part of the health, nutrition, etc. influencer space online. That's on YouTube, on TikTok, on Instagram, on Twitter. Okay? If these aren't doctors, if there's just sort of random people who are random health influencers, overwhelmingly this is going to be the case. There are exceptions. There are some evidence-based exceptions, but these exceptions are exactly that, exceptions. In the vast majority of cases, they drastically over-extrapolate from weak evidence to claims that are completely unsupported by that level of evidence. It's an inappropriate use of scientific data, scientific evidence to make a claim that is way out of proportion to what the evidence actually says. And I'll sum up what this next podcast I was just alluding to is going to be about. I'll sum it up. Why do they do this? Why is this so ubiquitous? Because in order to become famous, in order to become prominent, you have to make claims that are wildly sensational, and that capture people's imagination and attention and cause people to pay attention to you and make you famous. That's why these claims are so prominent on social media, which is driven by clicks, which is driven by traffic. And so there's also a connection between fame and money, because traffic drives money. That's why these claims are so prominent on social media. That is why the social media health influencer space is dominated by people who misuse science. Completely and utterly, overwhelmingly dominated by bad science. Okay. It should be pointed out that there are limitless ways to overinterpret and misinterpret the scientific data that exist. There are limitless ways to do this. One can produce an infinitude of different ideas about how health should work and about what things should work for health based on creative interpretations of misused evidence. So you can actually generate an infinity of fads from this method, essentially, this over-extrapolation method. More or less, it is the method of the dominant members of the health industry. You can generate endless fads, treatment interventions, supplement recommendations and protocols, etc. Endless, depending upon your own personal, idiosyncratic, creative reading of what the literature says. That is why these guys disagree with each other so much. The top health influencers so vehemently disagree with each other because none of them are basing what they say on the evidence. They're basing it on their particular idiosyncratic creative interpretation, like a Rorschach blot, or like interpretive dance, or like looking in the clouds and seeing faces and figures. Whatever face and figure you see up in the clouds might be different than the one I see. And so, you see one, I see another, and we're both making money off of our particular interpretation, and we're going to fight about it. Because we want to say ours is better, because we want to make the more money. Because by saying the other person's is bad and mine is good, I'm saying, give me the money, don't give him the money. It's about marketing, money, and power. But all of these infinity of different interpretations of this weak evidence constantly generate new fads and constantly generate argument and conflict among different influencers who are essentially equally all lying about what the evidence says and arguing about which lie is better. We know that these creative interpretations of the literature are overwhelmingly not only creative interpretations that have little basis in science, but we also know for sure that they're overwhelmingly false. So not only is the upper crust, the most popular YouTube influencers, the most popular people on Instagram, TikTok, etc., not only are the people with the millions and millions of followers spreading bullshit, it's more than bullshit, it's false. Bullshit sort of refers to things that are made up, invented, like somebody's trying to bullshit you. But these things are actually definitely overwhelmingly wrong. We know, based on the looking at which drugs succeed in randomized controlled trials and get through FDA approval after a phase 3 randomized controlled trial, that only 14% of all these promising drugs that start this process, only 14% make it through. The other 86% simply do not have enough benefit compared to harm. They don't work, or they're too harmful. For cancer drugs, that's 3% of cancer drugs and 97% failure for cancer drugs of making it through this process. More harm than benefit. So these are not the inventions of some health influencer on the internet, of their creative interpretation of Dr. Google or of PubMed. These are not some fanciful, strange interpretation of the scientific literature that's not based in a solid grounding of what that literature says. These hypotheses that are tested for FDA approval have millions of dollars behind them, decades and decades of scientists' career time, and an extraordinary amount of expertise, all supporting and believing that these hypotheses have a strong chance of working. And yet, only 14% of them work. What do you think the figure is for the health guru on the internet who creatively interprets the literature without a good background? Sometimes people say, when you're in an online discussion, but sometimes the most creative ideas come from the margins, the outside, and then they change everything. Because you need somebody thinking outside the box. You need a maverick who can then overturn the established order of understanding. And sometimes that's true. But what people do not understand is that the vast majority of time, that's not true. Some cases, you have somebody who is brilliant and lucky and is in a certain position to see something, to understand something, and make a unique contribution from outside the establishment. And this definitely happens. This is called fringe science. And sometimes fringe science becomes real science. And that's really cool. But we don't ever hear about the massive number of failures. Within fringe science, which I promise because they're so random and they're not based in any good understanding in the vast majority of cases, their success rate is going to be far lower than 14%, which is what we saw with the FDA approval process. If those hypotheses went through FDA approval, they'd be far, far lower, because often they miss basic established understanding of physiology, things that are not creative, but things that are just like being thrown against a brick wall. And they're gonna fail. Let's look at some more data. In a study published in 2003, 101 promising basic science discoveries in the top journals like Nature, Science, Cell. Only over the course of 20 to 24 years, only 19 of those groundbreaking discoveries that were supposed to be landmark and to change the world, only 19 of those led to a positive clinical trial result, fewer than 1 in 5. And only 5 became licensed for clinical use, or fewer than 5%. All these were breakthrough discoveries. All of these were supposed to revolutionize their understanding of things. But it turns out only about 5% do. And not even that. Only 1 of them became extensively used in a clinical setting. The other 4 didn't. Yes, they became licensed for clinical use, but they were never used on a widespread basis. 1% of the best findings in the top-tier journals, the most prestigious journals in the world, after almost 25 years of time, only 1% became a widespread, truly landmark, groundbreaking treatment that matched the initial hype. What do you think of some dude in his basement, or some dude on YouTube who's a bodybuilder or whatever, who's making things up? What do you think the chance is that that person is going to be more lucky and more intelligent than this? Let us assume, for the sake of argument, that the system is so corrupt that simply being published in a top-tier journal, a prestigious journal, indicates something wrong with the discovery. And that the man in the basement on Twitter, on TikTok, coming up with ideas off of his random readings of PubMed is more reliable than that. Let's assume this total clown world argument for the sake of argument. Still, if only 1% make it to widespread use, let's say the chances are 5 times greater for the guy, the random dude in his underwear on TikTok. Let's say they're 20 times greater. That's only a 20% chance of being something that's as important as that person thinks it is. 20% chance of making it, even if he's 20 times more likely than the best scientists in the world. And what is the likelihood he's going to be 20 times more likely rather than 20 times less likely? The odds are terrible that this person is right, no matter what. You must understand the people who run these randomized controlled trials to get FDA approval for their drugs, are spending millions of dollars doing so, are getting millions of dollars of funding to do so, are spending their lives doing so, believe it 100%, and are much smarter than most online influencers and much better trained, and their failure rate is abysmal. Why do you think going onto the internet, and just because it makes sense to you at the face of it, why do you think that means anything? It doesn't. Simply because somebody can explain something to you on TikTok or on Instagram or on Twitter or on YouTube, and it makes sense and it gets you excited, all that means is they're a great storyteller. You can tell stories that are made up and exciting that cause people to be excited about your idea fairly easily. That's called bullshitting, and there are people who are extremely good at that. But just because it makes sense and is plausible to you, or to even a million people, doesn't mean it's going to succeed. In all likelihood, it's not going to succeed. In overwhelmingly likelihood, it is not going to succeed. Because even the best of the best in the world fail more than 80% of the time. I don't know how to put it any clearer to you than this. And yet, there are still other papers showing the same thing. And I'm going to show a few of those before I continue. Now let's take another gold standard, not what scientists believe, but what actual practicing physicians who treat actual patients, who swear by their clinical experience, what are the things that are in widespread use in clinical practice? What are the odds that these work? That's a crazy question. What are the odds that things in clinical practice currently being used actually work? This has been tested too, which is such an amazing opportunity for us to gain further insight here. There's one study published in 2011 in the New England Journal of Medicine. There's two top journals in the United States. One is the New England Journal of Medicine, and the other is the Journal of the American Medical Association. The New England Journal of Medicine is a very prestigious journal. It published this paper where they looked at all the randomized controlled trials done recently in that journal of established clinical practice. And they looked and they evaluated what percentage of these practices, of these clinical practices currently being used at that time, until you got the clinical trial, what percent of those clinical trials actually showed that the treatment worked? Only 54% showed that the treatment worked. 46% showed that the treatment did not work. That is to say, half of practices that had not been tested, half of clinical practices that had not been tested by randomized controlled trial were shown, once they were actually tested, to be ineffective. So we're not talking about scientists. We're not talking about the best journals in the world. We're talking about the doctors with actual experience with patients who swear by these methods and clinical practices and drugs and treatments and have seen them work or believe they have seen them work half of the time when those things are tested. Of the things that were tested, they are shown to be ineffective. Another study published by the same group in 2013. They looked at all articles published between 2001 and 2010, and in this case, again, 40% of the treatments were shown to be ineffective. Only 3 out of 5 were effective up until that 2001 to 2010 period where the randomized control trial was published. Of those randomized control trials on standard of care, gold standard practices, only 3 out of 5 were effective. The other 2 out of 5 were not. Were not effective practices. What do you think is the likelihood that some jerk in their underwear on TikTok is going to come up with something to change the world when the scientists can't do it and the clinicians themselves only hit gold half the time? It's overwhelmingly likely to not work. Scientists rely on stories, clinicians rely on stories. They have a framework for understanding reality. They have a very strong, comprehensive understanding of what reality is based on that framework. Biological reality, medical reality. And they get it wrong a large percentage of the time. What is the chance that the random person on the internet is getting it right? That's why most of the things that are constructed as cutting edge derived from data that's not randomized control trial data, that's cell culture data, animal data, epidemiological data, short-term biomarker data, other forms of studies that are not rigorous. That's why when these health influencers overinterpret these studies, that's why most of the time they're wrong. We know that most of the time scientists are wrong, and at least about half the time, even working doctors are wrong. These people on the internet are overwhelmingly wrong. And therefore, the gold standard, the method by which to know we are right, is a long-term, rigorous, randomized controlled trial testing our hypothesis and seeing whether it actually helps the outcomes of patients. And by no other mechanism should we be making recommendations. In general, there are exceptional cases that we can talk about in a future video. But in general, that is the rule we should follow. I've decided, instead of simply having another video going along with this video, I'm just going to leave it the way that it is, because I think this went fine, or at least I think it went fine. And I'm just going to include the references, all the references I discussed in this video in the description, linked along with the video. And of course, as usual, check me out on thedietwars.com, thedietwars.com/support-me to help me out. If you want to support me financially, that would be much appreciated. Check me out on Instagram, YouTube, TikTok, Twitter. All that's going to be at Kevin N. Bass, KevinnNbass. as well as on Patreon, KEVINNBASS. YouTube is going to be at KBass Philadelphia. And you can also check out my podcast on Spotify at The Kevin Bass Show and on Apple Podcasts, again, at The Kevin Bass Show. Leave feedback and comments about how I'm doing, please, because that's always beneficial if they're well-meaning. Leave a rating. That would be cool to get my gold stars higher. And leave reviews, hopefully positive ones, on Apple Podcasts. If you like this video / podcast, share it with your friends, neighbors, family, dog. If your dog listens to podcasts about scientific methodology, share it with him or her. What else did I miss? Like, comment, subscribe to the podcast, subscribe to follow me, and see what else I'm going to put out, because it's all going to be good. And subscribe to the YouTube channel. Like, comment, let me know what you think about this particular video / podcast in the comment section. It helps the algorithm and makes this video gain greater circulation. I appreciate you guys listening. Please check me out again for the next podcast, or go back and listen to the other ones. This podcast is really a commentary on the last podcast that I have on cold water exposure killing, the cold exposure misinformation killing the mother of 3. So, but then this is also going to be, of course, a foundation for how we talk about science in general moving forward. So hope you guys liked it. See you later.